My name is Pamela, and I live in the Pascagoula area. I grew up in the projects over in the Pascagoula area over by Wangley's. I was a single mom almost half of my life.
Here's your water.
Thank you.
You're welcome.
My daughter is Shantae. She's like my right hand, but God sees me first, and then she comes in. If I need her to help me, she's always there. Like if it's raining and cold, Mama, you can't go out, because me and cold weather don't agree. It's rheumatoid arthritis that I have that affects your joints. This hand right here, it has turned in. They can re-break it and straighten it. I said, no, you're not gonna break my hand and re-straighten it. So I told my daughter, I said, I'm gonna start wearing gloves because I'm embarrassed of my hands. She said, Mama, some people don't even have hands to move. She said, don't do that. She said, go on, get your nails done, pep yourself up, and you're gonna be okay. And she really inspired me a lot. She goes to my doctor's appointments with me, and she makes sure that I'm on point, taking my medicine, and my blood pressure stays where it needs to be. She won't let me have a lot of things that I'm not supposed to eat, but I sneak and eat it, and then I take it to the dumpster and throw it away before she gets over.
Me and my mom are actually very close. We do a lot of things together. I'm a mom of two. She helps out with the kids when I'm working, or if I just need a break. My kids love my mom, and she loves them. My kids call my mom Big Mama. They gave her that name when they learned how to talk.
When I retired, I was 51. Right now, at my present age, I'm 57. At my former job, I was working with behavior kids out of Gulfport and Biloxi, and we had to go in at 6 in the morning, and maybe we get off at 5. I was a bus monitor, and I made sure they stayed in the seat and feet out of the aisle. I had to retire due to my medical reasons. I have an interstitial lung disease, and they were starting to use chemicals due to COVID-19, like the bleach and the chemicals that we had to clean the seats, clean the handles, clean the railings, everything. And it was taking away my breathing, so my pulmonologist took me off work because he said I was no longer to be able to inhale all those fumes due to my lungs. After I retired, I didn't have an income for like almost 2 years. And so my third year, I had called in to apply for my disability. I got a letter, and it said that I was approved. And my best friend was sitting right here. She said, why are you jumping up and down hollering? I said, well, number one, I'm getting approved for my disability. And it was amazing. And it's been really wonderful being able to pay stuff on your own. I received my Medicare and my Medicaid. I didn't know what it was for, and so I called my insurance lady. I said, well, I'm gonna need a secondary insurance. Who can you recommend? She said, well, I recommend Mr. Wendell Wells. I say, well, who is he? She said, well, I'll give you his phone number and you can call him and he'll come to your house and set you up with a good plan. And he did.
Hey, Mrs. Johnson, this is Wendell Wells. How are you? Yeah, I did get your message. I'm Wendell Wells. I'm a regional director for Advocate Health Advisors, and I live in Mobile, Alabama. Advocate Health Advisors help people navigate Medicare. We simplify it. We'll meet with Medicare beneficiaries, break it down to where they can understand it and help them select the correct plan. We're located in all 50 states plus Puerto Rico. I've been with Advocate Health Advisors for over 18 years. I'm a licensed insurance agent, so I have Medicare beneficiaries that I work with directly. My primary role is a regional director, and I oversee our team in the Southeast market. So it's Mississippi, Alabama, Georgia, Tennessee, Arkansas, Louisiana, Oklahoma, which is a new state for me, and the Panhandle of Florida. We have weekly trainings. They call me. We do joint phone calls. So my primary goal is to help develop, help train those regional managers in the market to serve our agents. Hey, Riley.
Hey.
Hey, Mace.
What's your day?
Busy. What about you? How was school?
Morning. Hey guys, the trainer sent some video of Rosie. She does not have a leash.
Where is that? At a park?
It looks
It's
like,
like, or like the beaches right there.
No,
Like,
I see the water.
downtown.
Okay.
and she's staying right there beside him, not running off or anything. I was
Imagine that.
like, whose puppy is that?
not ours.
We have a new puppy, Rosie. We love her. She's a new member of the family. My wife, Erica, works for a local power utility company. She is a community development specialist, so she's very active in her job. My daughter is, she's all about sports. In the backyard, we throw football. My son will go in the backyard, practices soccer by himself with his sister. We all have individual activities, but we do a lot of group stuff in the backyard, just hanging out together. Hey, I was just wanted to make sure, since the new coverage is in play, that you were able to get that prescription. Getting the right Medicare plan is really important. You could pay higher copays on your prescriptions. You could pay more out of pocket for just a visit to your primary care doctor. Medicare is so complex. Most people say, hey, I don't know what to do. Can someone help? And that's what we're all about. We're all about helping someone and providing clear choices so they can feel like they're making the right decision for themselves. Medicare beneficiaries qualify for Medicare at age 65 with 40 working quarters. It was called FICA tax, now it's called Medicare tax. There's another way to qualify, is through disability. After receiving 24 months of Social Security disability, no matter your age, you're also eligible for Medicare. If you look at Medicare, there's 4 basic components. Part A, Part B is original Medicare. Part C is also known as Medicare Advantage. There's some extra benefits that you pick up, dental, vision, and then there's Part D, which is prescription drug coverage. So it gives you additional coverage beyond original Medicare. For most people, it's a lot to absorb. And for us, our job is to explain all of those parts of Medicare and how Part C and Part D can provide benefit for them. I've been in the Medicare business for over 20 years because I started out working for a carrier. And for me, the reward is helping a senior. I can remember my grandparents picking me up from school and spending a lot of time with my grandparents. And as they age, I saw a tremendous need from increased visits to doctors or failing health, and I realized how important the healthcare system was for them and for me. Being in the Medicare industry or the insurance business is the perfect place to deliver that care to Medicare beneficiaries and seniors.
Good morning. How are you? God loves you. I love you. Have a blessed day and be safe.
I volunteer often in food pantries. I think having a personal involvement in your local community is important. It gives you credibility, and you can also see where there are unmet needs within the community. Pastor Pam.
How you doing?
Good. How are you? How are you? Food insecurity is something that, as an agent and working with agents, it's something that we see every day. For me, defining food insecurity is someone just saying, hey, I don't have enough to buy groceries, or looking in their refrigerator seeing nothing but food from a couple weeks ago, right? Food insecurity is probably more prevalent than we all think of. And after you see it, for me, I can't unsee it. So it's playing a role in trying to provide support. Once I got started, I just wanted to do more.
This is a free food mobile pantry sponsored by Feeding the Gulf Coast. We try to bring this program once a month into Stone County, where we give meat, produce, canned goods, and milk and dairy as well. We get over enough food to feed 250, maybe 300. But there have been times when over 600 people has been in the line. We are giving away 10,000 pounds today, and it only gonna go so far and cover so many houses. In this area, we have a lot of senior citizens and disabled veterans, and they need more support because they just don't have the income. It takes $300 and $400 for a senior to just get all the basic essentials. We try to make sure they have at least 2 weeks of food, without trying to go to the grocery store.
It's those same people that we're giving food to, we're seeing them in the community, and they're asking us about insurance benefits. We're talking about food insecurity. So it goes hand in hand, right? We're not there to sell insurance, we're there to volunteer, but because we're dealing with people with a food insecurity, sometimes we have a solution for them. I think the value of meeting customers where they are, sometimes they have transportation issues. So for me, it's almost like a service I'm providing. Hey, I'll come directly to you. And, I find that if I'm sitting at their coffee table in their home, they tend to be totally comfortable. And most people take us up on that opportunity.
Who is it?
It's Wendell.
Good morning.
Hey, Pamela, how are you?
I'm doing blessed.
Good to meet you.
Have a seat.
Okay, all right. When we first meet someone, I like to call it a needs analysis. Our goal is to have a tailored fit solution, right? We want to make sure their prescriptions are covered at the highest level. We want to make sure they can continue to go see the same doctor. And if they need to go to the hospital, their preferred hospital is in the network for the plan that we're discussing.
I was looking for a plan that was very affordable, that I could not have a very high out-of-pocket expense. My monthly expenses with my light bill, my medication, they are very expensive. Like the one injection that I take, it's literally $9,000 alone by itself. And I wasn't gonna be able to pay for it. It was like, either you're gonna buy the medicine, try to get a little portion of it, or buy food. Either you're gonna eat, or either you're gonna get your medicine.
She worried on a daily about bills, food. She didn't want her lights and water turned off. And if I would cook at home, I would, cook enough for me and my family, but I would also cook enough extra so that I could bring it over, but I still made sure that she ate.
That's the stress I had. I said, well, I'm not gonna be able to pay my bills, and I might have to move out of my apartment and move in with my daughter. Oh, I said, oh God, if that's gonna be the case, I'd rather live in my car.
People are often shocked or surprised to hear that, some people have to make a tough decision. Am I gonna get my prescriptions, or am I gonna complete my grocery list? For a lot of people, that's their reality. Oftentimes we can find a healthcare plan to help, but there's still a lot of people out there, they're making that choice. And you gave me some information I wanted to get from you, like your medications, your doctors, anything else that you wanted to ask before I kind of get started here?
I wanted to ask about the paper that I received from the Medicaid office.
Okay, all right. Okay. Sometimes we work with people that have both Medicare and Medicaid, and if they have Medicaid, totally different plans, right? So it's even more complex, right? So it's just best to have someone to work with you to figure out what plan is going to maximize your benefits. Medicare is a benefit that's received from the federal government and it's administered by the federal government. Medicaid is funded by the federal government, but it's administered by each individual state. Medicaid only goes to people in the low income category, right? So you have to be under a threshold of income to receive Medicaid benefit. Unlike Medicare, you get Medicare regardless of income, and you get Medicaid if you have very limited income. A dual special need plan is a plan for a person that has both Medicare benefits and Medicaid benefits. Pamela was eligible for a dual special needs plan because she had both Medicare and Medicaid. This is your eligibility notification, and that's the level that I've got listed. So yeah, I think we're in good shape. I'm going to share with you a plan that would be available for you based upon your current level. And she was indeed eligible because she had Medicare and the Medicaid level specified with the plus level. I think you mentioned that you've got a family member or a friend that has a plan that has a food card. Do you understand how those plans work or how those food cards work?
Well, she told me a short synopsis about it.
Okay.
That she can go to the store and basically buy like her vitamins and her toiletry
Okay.
and her hygiene products.
Okay. That's good. There's a few local retailers where you can use that card. That is a great benefit associated with the plan that I'm going to share with you, as well as some other benefits there. A food card is a benefit associated on a Medicare Advantage plan.
Do you have my butter down?
Yes, ma'am.
Okay. And a small bag of sugar?
People can utilize a food card. Usually it's a recurring balance on a Visa card. You can go to your local grocery store and buy food, buy healthy food every single month. So it could be some plans offer a $150 monthly benefit, some plans it's $200. And it allows for more dollars in the household to buy other stuff that you may need, paying for air conditioning, paying your power bill, right? So for a lot of people, it's helping with unmet needs.
The food card really works wonders.
How y'all doing?
Good. How about you?
I'm good.
Once you know that you don't have to spend money going by your toilet tissue and your deodorant, it makes a big difference. Cause like this month, I hadn't had to spend it yet, but I will.
We found a plan, a dual eligible plan. There was no co-payments for health-related services. So if she went to the doctor, no co-payment. If she went to the hospital, no co-payment. The plan had a food card, and also on her prescription, she paid $0. We were able to put Pam on a plan that provided all of her medical services at no cost share for her.
If it would have been me trying to figure it out, it would have been real, real hard. But Mr. Wendell, he's a good guy. He helped me figure it out, and we worked until he got me the best plan.
Being a trusted advisor, part of it is expertise, right? So we have to be licensed. If you're in this business, you have to maintain a certification, right? So every year we have to redo our certification. In fact, I just completed it last week. So that plays a big role. Plus, we have the knowledge to really explain benefits. And for Medicare beneficiaries, it makes the entire choice of picking the right plan, it makes it easier when you have someone that can really break down the information and deliver it in a manner where you can understand it. And it's pretty clear that, you're selecting the right plan. Advocate Health Advisors has an annual meeting. For me, it's great. We get to hear from the leadership of the company. Darwin always has a great presentation. We'll have industry experts. It's an opportunity for the employees to network, to see each other. We collaborate and we learn for 2 or 3 days. So it's a great meeting.
As you think about the networks and the benefit structures, and this is the value that we add, because it's confusing, and helping them know their rights and helping the beneficiaries get their rights is a big part of what we do. We enter the equation early. When people turn 65, we help them get the benefits they deserve. We protect them when they need someone to fight and back them up. We can educate them. We can set their expectations. And then we have an ongoing relationship.
I'm Dr. Darwin Hale. I'm the CEO and founder of Advocate Health Advisors. Originally, I'm from Ocala, Florida, and I started in the military. From that, I moved on to technology with IBM and AT&T. I rose to be the healthcare director, wrote the strategy for AT&T Business. Advocate Health Advisors has been in business for 20 years. And so there was just one person in the beginning, it's me. But now between independent contractors and the different full-time equivalents, we're over 5,000 strong, and we're across the country. We're a little more concentrated in the Southeast, though, because we did start in Florida. I was helping my mother, and she had turned 65, and I was in the healthcare area working on business strategy. And she wanted help with Medicare, and I was, feeling pretty good about myself. I had an MBA, I had a corner office, and I really couldn't make heads or tails of it. And so I ended up calling a friend that I knew through the military, and he sat down with us at the kitchen table, and we helped pick a plan for my mom. But I also saw an opportunity because I knew that was the beginning of the post-World War II generation moving into Medicare. The government had changed Medicare to have a new benefit that was very profound. They added prescription drug coverage, Part D coverage. Medicare hadn't really been changed since its origins in 1965. They also were wise to make it so that private companies would be able to offer that Medicare benefit. Because the private companies were allowed to do that, they didn't have the infrastructure. They didn't have career salespeople. That's what I saw as the opportunity, and that's what really created the opportunity for the business. In fact, I actually went back to school in my 50s and got my doctorate, and I studied broker quality in the Medicare Advantage industry. One of my passions for helping seniors is that I was lucky to have a friend in the military who could help my mom. And so if I could provide a friend to help other people's moms, it's sort of paying it forward. At Advocate Health Advisors, we are a national infrastructure of high-quality community-based brokers who represent and protect clients across this country. Community-based brokers fill a vital role, and that role is what we say support before, during, and after the sale. Now, they also have the benefit and financial skills and the insurance license and the specialized training, but the second thing they do is they primarily do what we call a needs analysis, and that is matching your unique circumstances in life and preferences to the plans available. When there's a conflict between a carrier and a provider, we have a client care team that's very unique to us. Sometimes the provider and the carrier don't see things the same way, and there's a little bit of a log jam, and that can result in you not getting the care you need or the claim paid. And so we have a good track record and ability to resolve those discrepancies. We help Medicare work better for clients, and we help them get what they're entitled to through the insurance carriers.
Wendell, long ago, I remember talking to you about people that have to choose between food and medicine that always hit home. Could you tell me how that plays out?
Well, I guess I didn't understand it until I saw it face to face, right? Going to homes and just hearing a Medicare beneficiary saying, hey, I have limited income. Sometimes there's a choice. It's a tough choice. Sometimes I get all the groceries that I need. Sometimes I get all the medication that I need, but I don't have enough money for both, right? So the doctor is always saying, hey, I need to adhere to my medication, but I just don't have the money. So, I think it's important for agents to make sure they find plans that could help with that unmet needs, and now there are plans that's helping.
There are many times when we do our needs analysis and we consider a chronic plan where that chronic plan has a particular medication on the formulary at a lower
Tier 6.
Right. Tier.
Tier 6, yeah.
Exactly, at a lower tier. So.
Yeah, exactly. Yeah, a lot of times that happens, but diabetes is a big one with that, especially because you have a core plan that doesn't really cover all of it. It has to cover some of the insulins, but it doesn't cover all of them. So you have ones that actually cover like Januvias and things like that that aren't covered on some core plans, and they're covered at a tier 6 or a tier 5 depending on the plan, and they get a lower copay.
And the tier impacts the price.
Yes, sir.
Yes.
And it happens a lot with those, the ER drugs. The extended release drugs are in a different tier than the actual normal drug is too. So there's different tiers out there, and the knowledge of what we have to go through training every year, and just job knowledge of what we do out in the field every day, and listening to it, and we learn what the difference is between those tiers and which one's going to fall where.
We had a gentleman that came in the other day. He had some prescription based on a health condition that changed. He couldn't afford the prescriptions. They seemed like they were more money than they should be. He came to the office. He came actually as we were heading out to dinner. One of our care team folks stayed behind and skipped dinner. She spent 3 hours working through the different formularies and problems. She actually found out that he had a level 4 drug, which is a technical term on the formulary that's more expensive, and that was the culprit that was making everything more expensive. So she then called back to the physician's office and asked if a capsule or tablet would matter. They said no, not at all. They called the pharmacy, and it was significantly cheaper, only $20. And he was, of course, elated. And so that's a labor-intensive piece of work, but that's the kind of thing that we get done every day.
Once we identify the right plan for a Medicare beneficiary, there's ongoing support. If there's a problem with the claim, oftentimes the Medicare beneficiary will call the agent, and we'll work with that Medicare beneficiary to find a solution. Over the phone, we discuss getting you prescription drug coverage. So when you called me the other day, I was kind of in a panic when you said you couldn't get your prescription filled. I think you went to
I couldn't get it filled.
Okay. During COVID, people on Medicaid were able to stay on Medicaid. And then after COVID was over, the federal government said that people on Medicaid would have to requalify. States started to bring people in or send out letters saying, hey, we have to redetermine your eligibility. Pamela lives in Mississippi. In Mississippi, we started getting a ton of phone calls from Medicare beneficiaries saying, hey, I lost Medicaid benefits or I lost a coverage level. She went to utilize her food card and her prescription drug card, and they didn't work.
I called Mr. Wendell. I said, Mr. Wendell. He said, yes, and Miss Pamela, what's going on? I said, well, I'm off of Medicaid. He said, off of Medicaid? What happened? I said, well, I went to swipe my card. They said, don't work.
She was very emotional. She says, Mr. Wendell. You know, I could just hear it in her voice because she had just left the pharmacy and they said, you don't have coverage, right? So you think of someone having a debilitating illness and not getting the medication that you need to help you function.
If she doesn't have her injection at the time that she's supposed to take it, her muscles will lock up and she can't really move around or use her hands.
I went by her house, I looked at the letter, and it said her status was going to change. So she was going from that maximum level to a lower level. She was bumped off of that plan because she didn't have that maximum level of Medicaid. So we knew we had to find something else.
And so when he got here, he said, we got to figure this out. I said, yeah, because tomorrow I need my injection. He said, oh, we got to work fast now. I know we sit down for about 2 hours working. He said, I'm not leaving until we get something resolved so you can at least get that medication. I said, Wendell, if I can get my injection, the rest can be okay. He said, I don't want you to get sick. I don't want you to get down. So we're gonna work.
So I researched and found that an emergency program called the LINET program. It's a program from the federal government to help Medicare beneficiaries that qualify to get immediate coverage to cover their prescription drugs. It worked out, and that benefit started the very next day. So she didn't end up paying anything for that very expensive infusion medication. This is proof that you're covered on the plan, and it gives us the numbers here. So you don't have a monthly premium to pay. You do have some cost share for your prescriptions, so you're paying $1.55 for generic medications, and you're paying $4.60 for all other drugs. So your brand names will be $4.60. So you have coverage now.
Thank you so much.
You are welcome. Now, This is somewhat temporary coverage, so we are going to have to find you another plan that covers healthcare and prescription drugs like we did the last time. Having a plan with a food card, that was still important for us. So a couple weeks later, I went over and we did find her an appropriate plan based upon her new level of Medicaid.
Wendell's a hard-working person, and he wants you to have what you need to have.
Part of what I love about this job is changing people's lives. Sometimes it's dramatic, like you literally help someone get something that saves their lives. But other times it just reminds me of the military when people who can't protect themselves get protected.
I spent a lot of time in this car, and me and my wife have officially dubbed it my office on wheels. So I take a lot of phone calls. I'll pull over and I'll have work calls. I have agents to meet with, agency owners to meet with, as well as some of our regional managers. Last week I was in Birmingham, New Orleans, and the Florida Panhandle all in 1 week. About 2 to 3 days per week I'm on the road, so that equates to well over 120 days per year being on the road. I still maintain what we call a small book of business. A couple years ago, I had a family member, we called him Big Jim. He's the older cousin, so for as long as I've known Big Jim, he was missing teeth. Because of disability, he obtained Medicare. And because he was also low income, he also obtained Medicaid, so he was dual eligible. And at the time, it was a plan that offered, I think it was $4,000 or $5,000, a huge dental benefit. So he was able to utilize that great benefit associated with his new plan to get dentures. So we went to visit him after that, and he was so excited. I remember he would smile, but he would cover his mouth with his hand when he was talking and laughing and smiling. But I just remember the joy of seeing him talking without covering his mouth with his hand. So you see stuff like that, and, as an agent, it really kind of validates, the late nights and the being away from the kids, and you really see the good that you're doing out in the community. I work with our regional managers located in different states, and primarily just making sure that they're working with their local agents and agencies. Martha Ott is an agent and an agency owner over in South Mississippi. She has this wonderful office. She's a great agency owner. And for me, she's the perfect fit for Advocate, right? She's doing the right things for her customers. She has some agents that she's working with. So everything about Martha is about serving Medicare beneficiaries.
Hey, how are you today? Oh, that's good to hear. My name is Martha Ott, and I am an independent agent and agency owner in Bay St. Louis, Mississippi. My specialty is Medicare. I've been in the industry for over 26 years. I had been in the nursing field prior to getting into insurance, and I decided to get my insurance license, and I have been working with seniors on a more helpful basis than I could by just giving them their medications, like what medicines are you on, and let's talk to your doctors. Let's make sure that they're going to accept the plan. Let's make sure that your hospitals are in the plan. And it's just been so much more rewarding working this side of the industry. So I like seniors so much that I married one. My husband's 20 years older than me. He's just wonderful, and he helps me with the seniors. He'll pass out my cards and say, hey, I know you're not Medicare age, knowing that they are. And he's one of my biggest fans and biggest promoters.
Here,
Look
yeah.
here.
There he is.
Look at the devil.
Gary.
What's up, brother?
Good to see you. Martha. That sign looks awesome.
Oh, what you think about that?
Looks good. When did they put it up?
Yesterday morning, actually.
As an agent, I really think you have to have that outgoing personality and just give off warmth, and that's what Martha does, right? She's outgoing, she's just that special person. Gary Mosser is a regional manager, and he works directly with Martha Ott.
My regional manager, Gary, has been one of my favorite people for so long. He's like a mentor that I never had, but Gary's always there for me. Kelly Corbin is an agent that works here in my office. She cares more about her clients than she does herself. And we are of the frame of mind that we go above and beyond. And Kelly just fits that bill.
Hey, y'all, I have a question. If you don't mind, I was late because I was on the phone with one of my clients, one of my new clients.
Okay.
And they are not dual eligible necessarily, but they're having a hard time with all the new deductibles. So I didn't exactly know where to start looking to try to help them.
That's hit a lot of clients hard this year. Most of the carriers have like a $590 deductible, and so they have to meet that $590 deductible before it starts reducing the price of their medications for the rest of the year. What I would suggest is the M3P plan, which spreads payments, including the deductible, out over the course of the year.
And there's a term they use for it. I think it's smoothing, but it's allowing them to pay for that medication, spread out the cost for the remainder of the year. So it allows it to be more affordable for them.
Do they charge them? Is there interest or anything like that?
Nope, no, there's no interest.
That's
It's
amazing.
just spreading that cost
Okay.
out over the 12 months or 11 months or however many months left in the year.
I think that plan is really, it helps so many people out. You know, mostly, just let your people know, talk to the pharmacist because they really know more about it than anybody else.
My goal is to help as many people as possible. Someone said that if you love what you do, you never work a day in your life. And that is totally true with me because I do love what I do. My clients become friends and I look out for their welfare. Well, hello, you must be Mr. Frank.
I am.
Hi, it's very nice to meet you.
You come highly recommended. My name is Frank, and I live in Mississippi. I'm 63 years old. I love fishing and hunting. I'm an artist. My house is like a gallery for my artwork. I enjoy it. I am retired, so I have a lot of time with my dog. Her name is Kiri. She's the light of my life. 30 years I drove big rigs. I worked 100 hours a week. And then I accepted a job down here to come down here and manage the #1 account for the company. And it was a dream job for me. I came down here and set up a terminal. My best days were when everything was going wrong. And at the end of the day, I'd go, that was a good day. It was great. It was a rush. My injury ended all that. I got out of bed 3:30 in the morning to be the first one in the terminal. Took 2 steps out of bed, coughed, and blew 5 vertebrae, L1 through L5 on my back. It ended my career. It ended almost all the relationships in my life. My life's better now. Forced into retirement and loving every moment. Miss Kiri was the reason I got out of the chair when I was hurt so bad, to take care of her as a pup. It sounds funny, but I think my dog gave me a reason to fight. I had pain radiating from my spine all the way down. Even the balls of my feet cramp downward. I fight that all day long. I'm on some really good medication that has been like a godsend for the pain. It's a daily battle, but every day's a victory. After 2 years on Medicaid, I was informed I had to be on Medicare. I did not want to be on Medicare. The information they were sending me about Medicare was telling me it was going to cost me $185 a month. I could not afford that. I was frustrated, aggravated, and I couldn't understand it all. Still don't understand it all. I'm real frustrated. I never wanted to be on Medicaid. My injury put me on Medicaid and disability. Now they're putting me on Medicare. I don't want to be on Medicare.
Oh, well, what are your concerns?
Affordability.
Affordability. Mr. Frank's main concern was the fact that he was going to have to now pay a Part B premium, and that's quite a chunk out of people's Social Security checks. And the medications. Medications are not cheap. So when he came in, he was already somewhat angry because he thought he was going to have to try to come out of pocket with those things. Well, there's good news for you today, because if you have the coverage that I think you do, you won't have to pay that $185 a month because the Medicaid will pick it up. Well, he was very enlightened when we found out, that he had a Medicaid level that would continue to pay for his medications and also the Part B premium.
That sounds good. That sounds good. The prescription being covered, I need that. I have great doctors, and I'm going to keep them. My mama, her plan, they tell her where she can go. I want to keep my doctors.
Well, I think I found a plan that's really going to work for you. Let's go over the summary of benefits, okay?
All right, thank you.
See how good it sounds. And I went item by item and let him know that all of his concerns were met, that his doctors took the plan, and that his hospital would be covered, and his medications fit the bill, and he wouldn't have anything to pay out of pocket.
She made it painless, did all the work. And she picked a wonderful program with a wonderful company. I'm so happy to be with them. I'm not a number with her. I'm not a number with this company she hooked me up with. I'm a name. If I have a question, I call. I get a smiling face, actual face on the other end. We see each other, and I can tell the smiles on the other side are genuine. There was an incident where I had something coming up on my back, and it felt like a cyst. I called this insurance company that Martha hooked me up with. They hooked me up with one of their doctor's assistant on video, and she asked to see it. So she right there prescribed me antibiotic, and within 30 minutes, my pharmacy was calling me saying my antibiotic was ready. It's so amazing just to see that other face on the other end, that smiling face on the other end, and know that I matter, my problem matters. I am blown away by her choice. She definitely had my best interest at heart.
And he was just really relieved, and he was not angry anymore when he left my office.
I made a friend, not just an agent. I made a friend, somebody I can count on. That's rare in this world. She walked me out to my car. Who does that? And I turned to her and I said, it just dawned on me. How much do I owe you? Her price tag for her services actually was to give me a hug. So I had to let down my guard enough. I'm not used to hugs. And that's her price tag, was for me to give her a hug. Really? I can do that. She's taller than me, so I'm hugging uphill. That's where angels should be, uphill, smiling down at you.
When I've helped a client, I get a feeling of pride, and oftentimes I'll just tear up. And it might look like I'm sad, but I'm just as happy and ecstatic as I can be to know that I fit their needs that day.
The highest quality brokers have a few common characteristics. Number one, they're in and of the community that they serve. Number two, they actively build trust and rapport with their clients and focus on making sure that they feel comfortable establishing the dialogue. Number three, they front load a lot of energy to get everything right in the first place because they know down the road other problems might happen and they head those problems off. And I would say lastly, they make sure that they check in and that they have an active line of communication, that their clients feel comfortable calling them at any time for any reason. And that's where they really make the system work.
Hey, I wanted to bring in these flyers for you. You know, the annual enrollment period is right around the corner, and this tells your clients about the Medicare annual enrollment period and the starts and what all they need to see me about. There's a pharmacy in town that I have a good relationship with, the pharmacist, and his name is Mr. Rudy, and we just get along fabulously, and I get to help his clients.
People usually call me by Mr. Rudy because my last name is a little bit hard to say. My pharmacy is located in Waveland, Mississippi. We have been in business for about 25 years. We have a great relationship with our seniors.
Good morning.
Oh, hey, Sarge, how you doing?
I'm doing just fine.
Good.
I came to pick up my prescription. I'm hoping it's ready at this time.
It is.
Hi, Mr. Rudy.
Hey, Sarge, how you doing today?
I'm doing just fine.
Good. Okay, we have a special program called PACMed, and this is for people that have a hard time taking the medications. And what we do is we put medications in it by the day and by the time of day. And we don't make it too confusing. We just put it as a morning dose, the lunch dose, evening dose, and the bedtime dose. And we tailor it to the needs of the patient. Medicare patients, usually they're retired, and they get just a little lump sum of money every month, and they have to portion it off to what they can do. And so people all the time tell me, I can't get this medication, I have to buy food, because the patient doesn't take the medication, it's not going to help them. And when we see that there's a problem, we say, call Mrs. Ott because she is the specialist with the Medicare.
Every year, a month or so before annual enrollment period starts, he wants to make sure that all of his clients know that there are going to be changes in the plans, and almost every plan changes. Everybody needs to have their plans reviewed at least once a year during annual enrollment period. So he lets them know a couple of months in advance by putting this little ticket on their medicine bags that says, call Ms. Ott.
Sam came in here, and he's a real buddy of ours, and he brings us food, and he waters our plants, and we do have some chickens on the lot next door to us, and he even feeds the chickens. And so he came in, and he was asking about insurance, and we told him to go see Mrs. Ott, and he called me up and thanked me and said she was very, very nice and handled all his needs.
My name is Sam, and my nickname is Sarge, and I live in the state of Mississippi. I'm a Vietnam veteran, and my rank was Specialist 5 Hard Stripe Sergeant. I am a retired military microwave communication teacher. I'm really a loner, but since I have this family here, they keep me quite busy. I can cook mostly anything, so what I do, I cook for people that I don't really have any place to go, but I would just go and buy food and I would cook it and I would just take it to them and they would be so glad to get it. And I just try to spread the joy. We have an event every year at the Bay St. Louis Community Center where they have Thanksgiving dinner for everyone. It's all free, you don't have to bring anything. And we've been carrying on the tradition, okay, so everybody volunteers. 700 to 1,500 people we serve. But the wonderful part is karaoke. Boy, it's hilarious, right? It's great. And you can see the smiles on people's faces. They're just being happy for that day.
You know someone that is in need of someone to help them get enrolled, please give it to them and just tell them to give her a call.
Good, so I take 3 types of blood pressure medications. I take one, and I think it thins the blood so it'll flow better. And also I take one that gets rid of the water in the system. And I take another one for cholesterol. I'm trying to find one pill for old age to make you feel better, but we hadn't succeeded with that as of yet. I used to go to get my medication from the VA, but then the medication that I would get from the VA was getting more expensive. I went to Waveland Pharmacist and I met the pharmacist, Mr. Rudy, and he recommended me to see Mrs. Ott. And she said, I'm gonna take care of everything for you.
Mr. Sam was in need of a personal agent that he could work with on a one-on-one basis. A lot of clients are used to 1-800 numbers calling them and they might be put on the wrong plan. Not that he was, but he just didn't know. And so he appreciates that personal contact. Mr. Sam is what we call a dual eligible, which means that he is on Medicare and Medicaid. And some of the benefits that come with a lot of the plans for that level of eligibility are, of course, the food card. And remember when we talked about the food card?
Yes.
This one has one. Not only can you use it for food, but you can use it for other allowances like your phone bill or your electricity bill or possibly even your mortgage.
I was using it to buy different groceries and so forth, but I have a Hancock food pantry that gives me food once a month. When I go there to pick up my groceries, because you don't know what you're gonna get, I actually get what I want and more. One of the things that I use this card for is to pay my electric bill, and it pays my phone bill. So I don't have to worry about paying this from my Social Security. And she set this up for me. All my medication is free. I don't have to pay for any of those medications anymore. It's great.
Some health plans have tailored benefit structures for what we call special needs groups. So they're giving you things that they know will help you be healthier and get what you need, because ultimately, the little secret here is that the health plans actually make more money if they keep you healthier. So they're always innovating ways to help you obtain a gym membership. If you're hungry, get a food card, have a drug plan so you don't have to choose between food and medicine. You know, they're really trying to do the preventative things and plan benefit structures that keep you healthy in the long run. Brokers, and community-based brokers in particular, play a vital role in ensuring that that system works and that that value is provided.
Well, Mr. Sam, I know we talked about your doctors and how, you keep getting referrals for this, that, or the other, and I know that you can use the VA if you want to, but I have a company that is primarily focused on your overall health. Yeah. It's called Sage. Mr. Sam does use the VA for some services, but that is kind of far away from him. Mr. Sam loved the idea of a one-stop shop for his doctors. He went to Sage, which is one of our healthcare systems, and he's just been really happy with the whole thing.
Sage Health is a newer, wiser, and innovative primary care for seniors 65 and older in underserved populations.
To be a patient of Sage Health, you must have Medicare. Oftentimes our patients also have Medicaid, so they're dual eligible Medicare, Medicaid. We focus on the senior population. Value-based care is set up to provide the best value that the patient can receive. We have fewer patients each day so that our doctors can provide more time with our patients.
We have a team of really dedicated professionals, physicians, nurse practitioners, cardiologists, dietitians, experts in wellness, supported by an amazing team of nurses, medical assistants, licensed clinical social workers. It takes a big team to do this, but it's the right combination of skills and training that really enables us to do this work really effectively.
After taking a tour and seeing Medicare beneficiaries walk in the waiting room, immediately being greeted, not sitting longer than 5 minutes in the waiting room, spending 45 minutes with the doctor, just getting personalized special care, I guess a light went off for me saying, hey, they are really taking care of Medicare beneficiaries.
So much of healthcare has become sick care, and we really want to focus on keeping people well. I like to say the goal of Sage is to keep people healthy, heard, and out of the hospital and out of the emergency room.
Coordinated care or value-based care is the future of all healthcare, and it's really about prevention beats cure. If we can catch something in a preventative screening, and then we can put you on some blood pressure medicine and not have a heart attack, it's obviously wildly better for you and your family. It's also economically valuable. So there is an economic component to healthcare. One of my catchphrases at work that I love to say is it's about lives saved, misery avoided, and cost eliminated.
Okay. Good luck. First number, 23.
We offer activities such as chair yoga, silver sneakers, they love it, bingo, arts and crafts, because we want them to come and see us. We want them to be happy because your social, your mental is all a part of wellness as well.
You know, Sometimes as many as a quarter of the senior population is isolated. They make a difference between isolation and loneliness, because there's some people that would say, I'm living with someone and I'm still lonely, so they're not isolated. But isolated is a level of danger that is problematic in care. A health club will have a gym and will have other, organized activities, and people go there a lot for the social interaction. We've got a model of care that has non-clinical things like exercise and diet and not being lonely and things of that nature that have clinical outcome impacts, favorable impacts, leveraging prevention to beat cure and using social determinants or non-clinical determinants of health. That really makes a big impact.
It's a family-oriented place, and it's a great place to go to. It's real warming and everything, and you go in there, and it's just a great place to go.
We do a lot of events with the SAGE community. The first one that comes to mind would be the bingo.
Oh, 62. Oh, I'm just 62. I don't get Medicare yet unless I got mine on 62. Unless you're disabled or on, disability for 2 years.
And bingos are fun for Medicare beneficiaries, right? It's bingo, they get to win prizes, right? So it's a way to get them in, to listen. So oftentimes we'll do a Medicare 101 and then we'll follow it up with a bingo. How's everyone? Good, good. I appreciate y'all coming out to attend my Medicare 101. I'll be covering some Medicare basics. Medicare 101s, by definition, they're educational, right? We want to make sure people understand the components. We want to make sure they understand how original Medicare works with Part C, works with Part D, and just answer any questions that they have. We're automatically trusted, right? Because we're at a facility like that and they feel more comfortable saying, hey, this is what I need help with, and we can oftentimes provide that help. We truly believe that if you work with a local advocate agent, you'll have the best person to work with, because we keep abreast of the new regulations and we also know all the plans that's available in the local markets. We're local, we're shopping at the same grocery store, we're just that local trusted professional.
Seniors need someone like me to sit down with them and go over all of their needs. No plan fits all. So you have to select, the things that are most important to the client, but you try your best to get those needs met in one single plan.
Whatever it takes, she'll get it done. She's Martha. She's always going to be Martha. So she's going to be my friend, and good friendship you just can't find. True friendship.
Don't try to do it alone. Put that paperwork down, make a phone call. Call Martha Ott. Sit back and watch her work, and then go, wow. She treats me like I'm important to her and in her life. She'll do the same for you.
I trust Mr. Wonder with my whole heart, because he's gonna be there for you. Because he's gonna go through all the channels, all the avenues that he needs to go through to help you. And after he leaves, 2 days later, he's gonna call. Did you understand, or did you need anything else? And if you do, I'll be back over.
I would strongly encourage everyone to make sure they have a community-based broker that they trust. Whether it's an advocate broker or some other quality broker, we want, from the time that they turn 65 or think about it, through their Medicare journey until their final days, wherever they move, whatever plan is best, we want them to have that relationship with Advocate so they know they've got a trusted advisor.